Well, welcome. My name is Lynn Gillette. I'm the president of the Silicon Valley chapter of AAII. We've got a great program today. We've had HICAP present to us before, and Marcelo has done it, and he does a great job. And so put your questions into Q&A as we go along. The speaker has requested that we basically cover an area and then he'll ask for questions. And so we'll cover an area. That way he can get through it. And then you can ask questions. So there'll be multiple points during the presentation when you can address questions. And if you just put them into Q&A, we'll be monitoring them and then doing the questions that relate directly to the topic covered. Just a general comment, we could always use volunteers. So anybody that would like to help us in terms of finding speakers, publicity, and Facebook management, that type of thing, where we would welcome help. The video, we are recording this program. So that recording will be available in about a week. So you can listen to the entire program over again. I do that quite often. And it gives you a way of seeing the slides again and also monitoring and picking up what's said. We have visitors with us today from all over the country, and the San Francisco chapter has been explicitly invited to join us, so we'll have a number of people from there. The format again is we start at 9, 5-minute introduction, and the speaker will be up at 9:05. So I'm just going to do a couple of things. The title of the presentation is 2025 Medicare Explained. Marcelo provides a comprehensive overview of all things Medicare. Medicare can be confusing and complicated. There is a Part A and B of the original Medicare, a supplement Medigap insurance plan. There is a Part D for prescription drugs. There is a Part C for Medicare, let's see.
Medicare Advantage plan.
Medicare Advantage plan. And some of you are probably into that right now. And which typically combines Part A, B, and C and D. Enrollment process comes around once a year, and you can choose different providers. You can choose a different prescription drug provider. And also, this presentation will help you unravel the rules, how HICAP operates, and the benefits and current prospective benefits. And this is a help to both relatives and caregivers in unraveling the Medicare insurance policies, even as it relates to COBRA. That'll be covered over there. Some of the topics that will be talked about required and optional parts of Medicare insurance, including prescription drugs, supplemental insurance. What are your options, and how do you make changes to Medicare? A little bit about Marcelo's biography. He is Director of Health Insurance Counseling and Advocacy, hard for me to say, program. That's HICAP. You'll hear that initial HICAP, and that's by Sourcewise. It's a state-sponsored, volunteer-supported program that provides counseling to people with Medicare about their benefits, rights, and options, and other health insurance-related questions. Marcelo received state certification for Medicare HICAP counseling in 2010. Since then, he's been the director. He manages HICAP, and and this is a chance for you, by the way, to go into their facility. It's near the Great Mall, and have direct counseling and discussion and information. Just an example of that, my prescription drug program more than doubled this year. So I will be going into their facility with an appointment, a list of all my prescription drugs, and see if I could do any better. And you're welcome to do the same. It's very good support, and it's an area that's dearly needed. So with that, I'll turn the time over to Marcelo, and I'm looking forward to this presentation. Thank you.
Great, thank you, Lynn, and thank you all for having me. Good morning. As Lynn mentioned, I've been with Sourcewise about 14 years. I started as a volunteer myself, having been affected by the housing crisis. I started Medicare counseling and was picked up, and then began doing presentations. Early on, the Affordable Care Act was passed, and I started helping with Medicare and Medi-Cal recipients with changes and options that were being tested by the Center for Medicare and Medicaid Services. And currently, I conduct trainings for our new volunteers and different corporations around the area for their upcoming retirees trying to understand that transition into Medicare. So I know that in this audience, we have folks who are local, maybe in San Francisco, even on the East Coast. Everyone may be at different stages in their Medicare journey, but I hope I can answer your questions. Again, I'll be stopping at certain major points, and certainly at the end, I'll stick around for any questions you might have. So as Lynn mentioned, well, as you can see, I work for Sourcewise, Community Resource Solutions. We exist to help seniors age well at home, and we do this by providing expertise, education, and quality support services to Santa Clara County seniors, their families, and caregivers. Since 1973, Sourcewise has served as the county's area agency on aging through a suite of direct services. And some of those services include our information and awareness program. And this is the first step to getting help that you may need in finding out what senior resources are available throughout the county. So the Sourcewise Care Management Program is the home of what's called the Multi-Purpose Senior Services Program. It's a program for people on Medi-Cal, which is California's Medicaid program for those with low income and resources. Our Meals on Wheels program is a donation-based program for those who are homebound and can't put together or obtain meals by themselves. And it's regardless of economic status. We also have a digital inclusion program where we partner with the Department of Aging to help mitigate loneliness and isolation among older adults 60 and older. We also provide a transit service, but mainly in Morgan Hill, San Martin, and Gilroy to adults 60 years and older. There are many caregivers in the county, so we have caregiver support, resources, and how to access that support through that program. We also have what's called the Public Authority Services, which supports in-home supportive services program providers. So IHSS is another Medi-Cal program that allows someone who has needs at home to hire somebody to help them. We also have a Dignity at Home Fall Prevention Program for Morgan Hill, San Martin, and Gilroy residents to learn how to stay independent and safe at home by preventing unnecessary falls. And as you know, falls are one of the major reasons for entering facility care. We also have a Seniors Community Services Employment Program. So seniors who are 55 years of age or older and are in need of support to obtain employment can take advantage of that program. And finally, Health Insurance Counseling and Advocacy Program, also known as HICAP. So we assist Medicare beneficiaries, their families, and caregivers to understand their Medicare benefits and healthcare options. So HICAP is primarily delivered through our team of trained and state-registered volunteers. They go through a minimum of 25 hours of training, a minimum of 10 hours of shadowing and internship. And then once they're registered, we deploy them, so to speak, throughout the county. If we are here to provide free, objective, and unbiased one-on-one counseling. We do that in person at different partner sites. We also conduct counseling by phone or video conference. So this is our phone number, 408-350-3288, if you wish to make an appointment with one of our counselors. Now, HICAP is part of the National SHIP Program, or State Health Insurance Assistance Program. And this is their logo, the tagline, Navigating Medicare. So every state has a SHIP program, and every county is represented or has representation. Every state, though, might name their SHIP something different than HICAP. So, for example, Virginia's is VICAP. There's an interesting one in Oregon called SHIBA. Here's the number. If you're not in our county, you would call 800-434-0222, and that would route you based on your phone's area code to the HICAP in your location. And a little change here. I think we can send these slides out, but for other states, you would want to go to www.shiphelp.org to find your local SHIP program. Again, not everyone is organized like us, but we have partners at different senior centers, community centers throughout the county of Santa Clara, from Palo Alto down to Gilroy, and in between over to Milpitas and Los Gatos. Our sessions are typically an hour long. They're free, and you can make multiple, you can talk to us any time of the year. I would suggest starting to make appointments early, because we're approaching the annual enrollment period that starts October 15th to December 7th, which is, now is the time to start evaluating your Medicare for the upcoming year if you already have Medicare. Now, what topics do our counselors discuss? As Lynn mentioned, we can help people understanding the process for signing up for Medicare, what the premiums are, what it costs to have it, what the benefits are in Part A, Part B, how Medicare supplements work, drug coverage in Medicare, the Medicare Advantage side of Medicare, which we'll get into. We also warn people about fraud and scams, and then other resources and how to get help. Now let's look at enrolling in Medicare Part A and Part B. Some of you have been through this process, but for those who haven't, let me just say that sometimes enrollment is automatically done by Social Security. So automatic enrollment into Medicare would occur when one is already receiving Social Security payments before turning 65, either in the form of retirement benefits or in the form of Social Security disability payments. So one would receive this red, white, and blue card 3 months before a person's eligibility month. If a person is not receiving Social Security payments before 65, then enrollment is not automatic. One has to take an active step of filing an application with Social Security. Either this can be done online, making an appointment with a local office. They still have a fax line, or by calling the Medicare number or the Social Security number there on the screen. You do not have to be retired to enroll in Medicare. But most people who are working past 65 usually delay enrollment in Part B of Medicare. So when is your first chance to enroll? It's what's called your initial enrollment period, or what we call an IEP. There's many acronyms in this program. The IEP is 3 months before the month of one's eligibility and 3 months after. So a 7-month window surrounding, in this case, someone's 65th birth month. So sorry, some of these months got shifted over, but in this example, Phil turned 65 on April 2nd. So the start of his IEP would be January 1st, and it would roll through July 31st. For those who have birthdays on the 1st of the month, Medicare or Social Security considers you to turn 65 the month prior, so everything would shift over by a month. Now, when submitting an application during your IEP, when would coverage begin? So filing prior to your 65th birth month would start Medicare A and B on the 1st of that month. So in this example, April 1st. We encourage people, if you're not on Medicare yet, to do things early in order to get your Medicare number so that you can then further enroll later in other products like a Medicare supplement, a Part D plan, or Medicare Advantage plan. But there are still other considerations on when to actually sign up. So if Phil waits for his birth month or any month after that, then Medicare by law starts the month after. Now, as I mentioned, many people are working past 65, so let's take a look at that scenario. So employees who are about to turn 65 and remain in their employer plans, they'll usually ask us, should I enroll in Medicare Part A at 65? And usually the answer is yes, since Part A is likely premium free and would provide secondary hospital coverage to the employer's insurance. But starting, I'd say 10 years ago, there are more and more exceptions to that. The exception being that when an employee is in what we call a high deductible health plan and makes contributions to an attached health savings account, an HSA, then applying for Medicare Part A would result in a retroactive start date, and any contributions, HSA contributions, after the retroactive start date would carry a 6% excise tax if not withdrawn before the end of the tax season. So if you wish to make HSA contributions while still working, be sure to stop those contributions 6 months prior to your filing for Part A. So the next question then is, employees approaching 65, they'll ask, what about Part B? And when to sign up for that? I've heard there's a late penalty if I didn't. So the answer is during your special enrollment period. So let's see when that would begin and what qualifies one for a special enrollment period. You could call it a Part B or Part B special enrollment period. Now with this, there are some issues when people are working with employers with 20 or fewer employees. There's some coordination issues, but feel free to reach out to HICAP if you're in that situation. But most people are working in larger companies. So to establish one's special enrollment period, there must be two criteria met. The first is that you have active employment by yourself or by your spouse, and that you're enrolled also in a group health plan due to that active employment. So if at 65 you meet these two criteria, then you'll be in a special enrollment period that lasts as long as those two pieces are in place. But once one of those pieces falls off, then you have 8 more months to your special enrollment period ends. Now, you can, again, enroll anytime during your special enrollment period. You would also use this form called the CMS L564, which is proof to Social Security that you had active employment and that and the dates of your coverage under that active employment. And they'll use that form to eliminate any late penalty because they'll be counting the months after an IEP, assuming that you ought to enroll in Medicare. So, but the SEP will help you avoid any late penalties. So coverage typically starts the month after when applying in the last 7 months of your SEP. Now, most people know their retirement date in advance and want to start Part B so there's no gap. This SEP allows you to request a start date up to 3 months out while both criteria are met. But when applying after work ends or coverage ends, the application submitted in the last 8 months of an SEP by law will start the month after. Okay. Let me stop there and see if there are any questions about enrolling in Medicare A and B and special enrollment periods.
There's no questions in the question and answer chat, but I've got a couple.
Okay.
The CA birthday rule, does that apply to both Medigap and Advantage plans or only Medigap?
Just to the Medigap plans.
Okay.
And
yeah. Go ahead.
Right. So yeah, I'll certainly cover Medigap enrollment periods. So you're kind of getting a sense that every part of Medicare, every product of Medicare has its own enrollment periods triggered by certain events, and that is certainly one of them in the Medicare supplement product world.
Looks like a couple of questions. Oh, go ahead, Deborah. A couple
Go ahead.
of questions.
I haven't seen them. Are you seeing them?
Yeah, the first one is, I turned 65 last month. I have coverage through my employer. What steps are required for Medicare for me?
Right. So if you're going to continue to work past 65, then what I would ask is, do you have a health savings account with a high deductible health plan? If you do, then there's no need to sign up for Part A or B at this time if you want to continue to contribute to that. If you don't have a health savings account with a high deductible health plan, and I should say you have employment with a group of 20 or more employees, and you're actively working, then sign up for Part A at Social Security. I would contact them right away. Well, there's no rush, I should say. Part A is free and you can sign up anytime if you don't have to pay a premium for it. And it will start no earlier than your 65th birth month, so next month. But if you still wish to continue on your employer plan, you can certainly keep it and only sign up for A and don't sign up for B. so that you don't pay the Part B premiums. If you did sign up for Part B, it would be secondary to your employer plan. Now, would it be worth it? As you'll see, there are premiums for Medicare every month, which go up depending on your income. So it may not be worth it to add the Part B premium to your employer plan as a secondary.
I see the questions now, Lynn.
Yeah.
The second question is, I still have employee-provided insurance, but I retired in February. I assumed I was not required to sign up for Part B, but I did sign up for Part A when I turned 65 2 years ago.
So when one stops work and continues with their employer plan, that could either be a COBRA plan or it could be a retiree plan. Now, some retiree plans require that a person sign up for both A and B to make use of or stay in a retiree plan. So there are many different types of retiree plans. So I would check with your carrier or your HR group to see, well, do I need to sign up for Part B to have full coverage under, with the retiree plan as a secondary.
Okay, we're starting to get a number of questions coming in now.
Okay.
Can the 6% penalty on HSA contributions after Medicare begins or within 6 months of Medicare begins be avoided by withdrawing the HSA contributions and employer contributions during the same tax year? And
Yes,
then I would pay income tax on those withdrawn contributions.
yes, that's correct.
Do you have time after the end of the calendar year, or does it have to be withdrawn within the calendar year?
Withdrawn before filing your taxes.
So normally by April 15th or,
Or yeah.
my employer was the federal government. I don't know what that means, whether
That's an add-on to a former question.
yes.
Thank you for clarifying. So federal employees, I guess my follow-up question would be, are you retired from the Postal Service? If not from the Postal Service, then federal employees are not required to have Part B to make use of their FEHB health plan. So that's the one exception I was thinking of.
What special considerations
But
should I
I
look
might add, sorry, that since you're not signing up for Part B, then Social Security, however, is keeping track of the months that you're not enrolled in B. And you would be subject to a late penalty should you change your mind and want Part B later on. And I'll expand on that in a few more slides.
So you cover the penalties later?
Yes.
Okay, then I won't ask that question now. What special considerations should I look at if I work at an employer with less than 20 employees?
So an employer with less than 20, so the rule is if you're with an employer with 20 or more employees, they're required to provide you the same employer group health plan as anyone under 65. That, however, doesn't apply to smaller employers, fewer than 20 employees. So they aren't required to provide insurance to you, but in which case, if they didn't, you would want to sign up for Medicare A and B coverage right away. Now, if they do offer you coverage, what you have to clarify, and it really depends on each company, is whether they let me back up. The minute it's more of a primary secondary coordination of benefits. So if you have employer group health plan with 20 or fewer employees and you sign up with Medicare, it's the employer plan that it's Medicare that's primary, and the smaller employer group would be secondary. Whereas if you're with a large group and you're still working, the employer plan is always primary, and Medicare would be secondary. So I've had some cases where owners of companies who have a couple employees, they just want to continue using their employer plan, and they may just say, I'm not enrolling in either A or B, because once you enroll in A or B, then that switch happens. Medicare is primary and the plan becomes secondary. So some companies, small companies, will say, well, tell their employees and maybe put in writing, advise them, don't sign up for A and B so that we will continue to be primary for you. If it's a great health plan, then it works out for everybody. So there are some nuances there. Okay.
Next question. After 65, if one still has an employer plan, what is the benefit of having it? He said part one, but I think he means part A of Medicare.
Yeah. So if you are working past 65, delay part B, the benefit of having part A is it would supplement hospital coverage of the employer plan. So suppose you're 66, still working, you end up in the hospital. The hospital bill would go to your employer plan first, and maybe you have a deductible or co-pays, but before you pay those would be sent to Medicare Part A, which is sitting in the background. And your employer plan would pay its portion. Any remainder would go to Medicare. Medicare would adjudicate it. There's a what's called a Part A hospital deductible of, I think it's $1,600. So after that's been met, then the bill would go. If it hasn't been met, then you would pay up to that deductible, and then so it provides extra protection in the hospital setting.
There may be more questions now. Let me scroll down. Yes, part A. Yes, he confirmed it was part A. You said on the part A that it was retroactive for 6 months, but that doesn't go past your 65th birthday, right?
Right. Yes,
So
that's
the
correct.
HSA contributions would need to end at your 65th birthday, not 6 months prior, right?
Yes, in that case. So, if you're contributing in the 6 months after your 65th birth month and sign up, I'm sorry, if you apply for Medicare within 6 months of your 65th birth month, those contributions would all be excess contributions. Of course, you can contribute, but some people retire at 67, so they can contribute all the way up to, let's say, 66 and a half, and then apply at 67. Part A would go back to mid-year 66, and you would protect yourself from the excise tax.
If you're working past 65, shouldn't the employer be issuing a statement of credible coverage so that if you apply at a later date, you have proof that you were covered?
So that's a good question. So, and the terminology here, the word creditable coverage applies only to drug coverage, Part D drug coverage. So what that means is the drug portion of an employer group health plan. I think it's I can't remember which month, they're supposed to send you a letter telling you whether that employer group coverage, the drug portion, is creditable. In other words, it's as good as Medicare's standard Part D drug coverage. And you need to keep these notices for the future when you later sign up for drug coverage under Medicare, because again, there's a late penalty unless you can show that you had this creditable drug coverage from an employer or from the VA or from FEHB drug coverage. That's that creditable proof helps with Part D. Part B, avoiding a late penalty, depends on these two criteria. It could be terrible employer coverage, but as long as it's a group health plan, it meets the second criteria in this special enrollment period to help avoid a late Part B penalty down the line.
Okay, there's two more questions. My spouse has never worked and does not have 40 credits required for Social Security. Is she still eligible for Medicare when she turns 65? She is a US citizen.
Yes, so she is eligible for Medicare. Without you, she would, of course, be eligible, but would have to pay. And I'll show you that later. But she can qualify for premium-free Medicare under your Social Security work history.
So potentially after 65, if one gets medical from the employer, one can sign up for a high deductible plan, not pay HSA, sign up for Medicare Part A and B, and Medicare A and B pay for any monies that the employer high deductible plan does not cover.
Oh, okay. Yeah, so I think this is the question, or you're saying, once eligible for Medicare, you can have a high deductible and still working, join the employer's high deductible health plan with an HSA, but sign up for Medicare A and B as a secondary to that high deductible health plan. Of course, you wouldn't be able to contribute to the HSA, but Medicare could act as a secondary to the high deductible health plan. That's correct. Yes, yes.
You said that the VA was creditable coverage for Part D, but my understanding is it doesn't coordinate, Medicare does not coordinate with VA.
That's correct. It doesn't coordinate on the medical on any side. However, the VA drug coverage or benefit is considered creditable. I don't know if you might have to show proof that you have the VA, but it's creditable, so you wouldn't need to sign up for a drug plan um, um, to avoid a late penalty. You can have both the VA and a separate Medicare drug plan, but it's not, you won't be penalized if you don't get Part D because you have creditable drug coverage through the VA.
I'm not seeing any further questions. Are you, Lynn?
Nope.
Okay,
Okay.
great. So good questions. I'm going to move on to, well, because of the volatility in the job market, I thought, it'd be worth talking a little bit about COBRA continuation coverage as it relates to Medicare eligibility. So the Consolidated Omnibus Reconciliation Act, or COBRA, it ensures, again, continuation of employer group health coverage. It's available to employees, their spouses, and dependents. They lose employer-provided health insurance due to job loss or reduction in hours, due to divorce, death of the covered employer, or other qualifying events. Now, typically, COBRA lasts 18 to 36 months, depending on the qualifying event. What does it cost? Well, the one who elects COBRA pays the full premium. In other words, what the company's been paying plus the employees portion, and then I think it's 2 or 2.5% for an administration fee. So it can be costly. What it does is it continues the same health insurance plan while employed, including hospital, dental, vision coverage. So one question that those with COBRA ask, who've elected COBRA ask is, can I keep it when I become eligible for Medicare? And those with Medicare who are still working, and usually just Medicare Part A, we'll ask, can I have COBRA with Medicare? So let's take a look at some of those general rules. Now, let's start here. If you're eligible for COBRA and you already have Medicare, let's say Part A, your employer must offer COBRA coverage and you can keep it. Medicare, by law, would be primary to COBRA. Whether you have A, B, or both. And just as a side note, some people may have COBRA. When it ends, it triggers a Medigap enrollment period of 6 months. So as Deborah mentioned earlier, sort of forecasting ahead, there are these Medigap plans that people want. The loss of COBRA is an example of something that triggers 6 months to get a Medigap, no questions asked, no health screen. Now, if you have COBRA first and later become eligible for Medicare, employers or plan administrators may, and usually do, terminate COBRA coverage or the employer coverage when Medicare begins. Spouses and dependents, however, may continue their COBRA coverage. So we warn people because basically we say, don't get bit. COBRA may extend employer group health plans. It is an employer group health plan, but it is not due to active employment, that first piece of criteria for a special enrollment period. So the Medicare Part B SEP is not extended beyond 8 months of loss of work. So if you delay Medicare while being on COBRA, you may face a late Part B penalty. In addition, more seriously, I would say, is that if you have A and COBRA and lack Part B, you could be liable for a lot of the medical outpatient costs, and we have come across many cases like this. Okay, just so some key takeaways. Enroll during the right enrollment period, either the IEP or your SEP, to avoid penalties. There are special circumstances, again, that allow enrollment outside of an IEP, namely the SEP. And seek guidance if you're unsure about eligibility or enrollment. Now, if you do miss your IEP or your SEP, if you had one, the next opportunity is what's called the General Enrollment Period, or the GEP. And every year, this is from January through March. When applying during those months, coverage begins the month after you sign up. And there may be, because there's been quite a delay, there may or may not be a late penalty. And the Part B premium penalty is essentially 10% for each 12-month period of delay. Some people are lucky, they missed their IEP, don't have an SEP, but the GEP is right around the corner. Somehow they're able to avoid that, keep it under a 12-month delay. There are some new SEPs, I should say, for Part B. In the past, let's say you missed your special enrollment period and now you face a permanent late penalty. You could get relief if you could prove that someone from Social Security gave you incorrect information. That's been expanded. So if you might have received incorrect information about your timing of enrolling from your employer, from your employer's health plan, then Social Security would call that maybe an exceptional circumstance, and you may be able to sign up for Part B without penalty. There are also exceptions. Let's say if you missed an enrollment period because of medical conditions, maybe you're in the hospital or undergoing some serious treatments, then there are some exceptions made in those cases. So to summarize these enrollment periods for Medicare A and B, there's the IEP, the SEP, and the GEP. So now let's see what the monthly premiums are for Part A and B. It's mentioned earlier. Well, let me back up. Who can have Medicare? Citizens, as was mentioned earlier, green card holders with 5 years of continuous permanent residency at 65 and older, those under 65 who have received Social Security disability for 2 years, they are also eligible for Medicare. And anyone with end-stage renal disease or kidney failure at any age with enough work history may have Medicare. Now, 65-year-olds with at least 10 years of Medicare taxed work, which comes out to what we call 40 Social Security credits or quarter credits, they used to be called, are entitled to premium-free Part A, as you can see on this slide. Zero premium. 65-year-olds with fewer than 40 SSA quarter credits, though eligible for Medicare, would have to pay a premium starting at $285 per month, and as high as $518 if they have fewer than 30 credits. There are 2 programs that assist with Part A. There's something called the QMB program for those with lower income and resources. And the second program is for those who've been able to find gainful employment and stop Social Security disability insurance, and thus automatic enrollment in Part A. So they can still actually pay for Part A, but get help through the QDWI program. We have some clients who are just shy of 40 quarter credits. So how do you earn one? One quarter, sorry, this slide, it should show how much one earns to get a quarter credit. So you can only get 4 in a year, but I think we're at $1,400 or $1,500 to get 1 credit. Okay. Now, Part B premiums, on the other hand, are calculated by one's modified adjusted gross income, or we call it MAGI, from 2 years back. So that's for 2025, they're looking at the 2023 tax return. The standard premium this year is $185 per month per person. So if your MAGI is in a higher bracket, then you'll have a higher premium, which, if you're still working, typically you're maybe in a higher bracket. Now, here are the income brackets for 2025. Looks like some things got shifted. That circle is supposed to be around the 185. So again, that's the standard Part B premium. If you're in a higher income bracket, so this is for individuals, and this is for those who file jointly, then you would have what's called an IRMA, an income-related monthly adjustment amount. In this next bracket up, $74 would be added to the 185, resulting in a premium of $259. So this is the IRMA for the higher MAGI brackets. And it goes to 443 this year. The highest premium would be $628.90. Now, so this may discourage some employees from signing up for Part B if their IRMA, starts to get into the higher brackets. If you have what's called a life-changing event, however, which lowers your income from maybe one bracket to another, you can notify Social Security Administration or submit a form called the SSA 44 that recognizes the following life-changing events. So if you're married, divorced, or become widowed, that's a life-changing event. And if that life-changing event lowered you into a different bracket, then you could submit that SSA 44 form. Another life-changing event is you stopped work or reduced your hours. You lost income-producing property because of a disaster or other event beyond your control. You or your spouse experienced a scheduled cessation, termination, or reorganization of an employer's pension plan, or you or your spouse received a settlement from an employer or a former employer because of the employer's closure, bankruptcy, or reorganization. What this form does is it requests that Social Security use more recent lowered income information to determine your Part B premium. So keep that in mind if you experience one of those life-changing events. There are programs that can help those with low income and low resources with the premium. These are Medi-Cal, so anyone who has free and full Medi-Cal with no share of cost can have the Part B premium covered. There's something called, again, Quimby, but there are two other programs that will help pay the Part B premium. And as I mentioned earlier, QMB also pays the Part A premium, but your income has to be at 100% of federal poverty limit. And then, by the way, enrolling in any of these, if you're qualified for any of these programs, then a person gets automatic extra help with drug premiums and copays. Now, let's suppose you have, well, let me stop for questions right there before we get on to the Medicare Part A and B options, or ways to arrange your Medicare, rather.
There's a number of questions.
Okay.
So the
great.
first one is coordination between employer and Medicare A and B. Medicare A and B for any monies that the employer high deductible plan doesn't cover. So
Right. So let's say you have a high deductible health plan. So let's just say it's $7,000 that your deductible is $7,000. You go into the hospital. The contracted rate between the hospital and the plan, let's say, is ends up being $3,000, right? So if you only had that plan, you would be paying $3,000 out of pocket. But so the plan says, okay, got this $3,000 bill for you. We're paying our portion. The $3,000 would go to Medicare Part A and to Part B. Part A portion would say, well, you haven't met your $1,600 deductible, so you owe $1,600 and we'll pick up the rest. So in the end, you will pay, the hospital charges would be the $1,600 deductible. The rest would be paid by Medicare A and or B. The hospital bills often have, hospital charges and then the doctor charges. So A and B would be needed to cover, all of the different aspects of that bill, or as a secondary. So how that works then is your employer plan would say, okay, you've met $3,000 of your deductible. Whereas out of pocket, you've only paid $1,600 because Medicare picked up a lot of it. I hope that helps.
Next question. So what about the period from October 15th to December 7th? I'm a bit confused about the general enrollment period.
Yeah, so general enrollment is only for signing up for A and B. You're referring to what's called well, there are different words for it, but October 15th to December 7th is known as an annual enrollment period or annual election period. Some people call it Medicare open enrollment, but I don't use that term. It's for people who already have A or B or both to change, add, or drop Medicare Advantage plans or Medicare drug plans.
What about Medigap policies?
So I'll get into those
Okay.
shortly. Yeah.
Do I have to renew enrollment every year?
For Medicare A and B, no. As long as you
Um,
keep paying the Part B premium, you'll stay on Part B.
And the Advantage plans and Medigap roll over. You don't have to re-sign up every year, correct?
No, as Medicaps, if you keep paying the premium, they'll roll over. Medicare Advantage plans, if you do nothing, it'll roll over unless the plan will announces they're leaving the market or they're changing the name or moving members to a different plan of theirs. So we're in September, so we're approaching the annual enrollment period. Now is the time that drug plans, Part D plans, and Medicare Advantage plans send their annual notices of change. So always look out for those letters, read them carefully. If you don't understand them, then certainly give us a call.
If working after 65, can one decline employer health coverage and just sign up for A, B, D plus Medigap?
Yes. Yes, you can.
Is the 10% per 12-month delay penalty applied to the basic Part B premium or Part B plus IRMA?
The standard premium, just the standard 10% of 185.
Is it per, I was confused. I thought it was a per month penalty, but you're saying it's an annual penalty.
The Part B penalty, if one has it, it's permanent.
Oh, well,
And it's 10% for every 12 months of delaying enrollment. So if you went 2 or 3 years of not having B when you could have and didn't have any employer group health plan or employment in between, you could have potentially a 30% penalty. So the 30% each year is based on that current year's Part B premium. So next year, we anticipate Part B premium going to $206 per month. So the 10% penalty this year would be an extra $18. Next year, it'd be an extra $20.
so if you were without coverage for 15 months, it would be 10% because you were without coverage for a 12-month period.
Right, correct.
Okay. Suppose I leave employment this year at age 64, take a new job, decline health care until I become eligible for Medicare next year. Are there any penalties?
No, the late, let's call it the late penalty clock, the months, the month they start counting is the month after your IEP. So, if someone's, if let's say birthday's in September, my IEP would end November, December. So if I didn't sign up for Medicare, they would look at January as the first month of non-coverage, and every month after that is tabulated until I sign up during a general enrollment period, and then they add up the months, and then for each full 12 months, it's 10%. So in this example, as long as you use your initial enrollment period, then you will avoid a late penalty.
Are the Part B premiums for individuals? So for a couple, it would be double.
That's right.
What are the enrollment periods for Part B after my employer plan ends?
So that's the special enrollment period. As long as you're working and have coverage, active coverage due to that work at age 65, you are actually in an ongoing special enrollment period while those two criteria are in place. You'll know when you're going to retire, so you can prepare and maybe submit an application 3 months before you know you're going to retire. On the Part B application, you can say, I want Part B to begin 3 months out, like right after my employer coverage ends, or 2 months out, or 1 month out. Um, um, so you're using the special enrollment period to submit your application. With that application, you'll need the that form that your employer fills out that says, yes, so and so was employed with us, on these starting with this date at employer group coverage starting here. They're really just interested in the months when you turn 65, because those are the potential penalty months. So application for Part B, the proof of employer coverage gets submitted, and then it could begin once employer coverage finally ends. So there's no gap in coverage.
Irma question. What if I received a one-time huge capital gain that took me to the maximum Irma when I was at zero the year before and the year after my 2023 tax return?
Yeah, so you have to plan for high Part B premiums 2 years down the line.
So for
There's
20,
really, there's just no avoiding it.
will it go back automatically to
Yeah,
the, how good are they at doing that? I've heard there's been some issues.
it's with all these changes, and I know Social Security is they're not hiring anyone right now. I don't know how many people have lost work. I know they're trying to streamline their systems, update systems. I uh, um, I would keep an eye on it. I don't know. They don't. You'll get a notice, I think, prior to, and some of you may know this more than I, but I think there's a notice that tells you what your upcoming Part B premium is going to be, or how much is going to be deducted from your Social Security check. And I'd say at that time, if you see something incorrect, like they're still using that magi from the sale of the house, then I would start contacting Social Security.
What is the form name for Part B major lifetime changes?
Oh, okay. Let me go back. That's the SSA. Sorry, SSA-44.
Okay.
Yeah. So yeah, the SSA-44.
Are you using the word Medigap to refer to a supplemental plan? If not, what?
Yeah. Yes, I am. Technical term is Medicare supplemental insurance. That is a Medigap. Sometimes people use the term supplement to Medicare to mean employer plans that are secondary to Medicare, or even sometimes people will say, I'm using Medicare Advantage to supplement Medicare, but I don't, that's confusing to me. Yeah, so Medigap is supplemental Medicare insurance designed specifically to cover the gaps or the out-of-pocket cost of using, as we'll get to, original Medicare.
Um, I'm 67 on Medicare A and company insurance. I had a broken ankle, emergency services, surgery for several $1,000s. Company insurance covered most. Medicare A can cover some of the remainder?
Um, can you, sorry, could you repeat that one more time?
Broken ankle,
Mm-hmm.
emergency services, surgery for several thousand. He has
Mm-hmm.
Medicare Part A and company insurance.
Mm-hmm. Okay, I see. So Medicare Part A, and I'll get to that too, covers inpatient hospital services. So if you were formally admitted to the hospital, not just being treated in the emergency room, then there could be some Part A coverage, secondary coverage to the employer plan. But if you weren't admitted, then no, there would be no secondary coverage.
It isn't always easy to determine if you're under observation or admitted, is it?
It's not always easy. We've heard stories of people in the ER under observation for several days, but there are more protections now, so they have to inform you about your status if you have Medicare. It's called the Moon Notice. I can't remember what the acronym stands for, but um, um, and you can, I think, as patients who have Medicare, it is important to ask, am I an inpatient or is this right now an outpatient stay? That will determine whether Part A is covering it or Part B. So no, it's not always clear.
My husband did not sign up for Part A when he turned 65. Is there a penalty now that he is 69? He is still employed with a large employer and has insurance through them.
No, it sounds like you and your husband probably have enough quarter credits of paid Medicare tax. So no, um, there's no late penalty for those who are entitled to Part A, or in other words, have free Part A. In fact, you can sign up, submit an application at any time, and it would go retroactive 6 months. Keep in mind that after your full retirement age, submitting a Part A application would also, you'd also have to start drawing Social Security retirement payments. And yeah, so those go hand in hand after full retirement age. You cannot not have Part A without retirement benefits and vice versa after your full retirement age.
This was just a comment from the previous question. Understand I was in and out of ER in a couple of hours. Thanks for answering.
You're welcome.
Can we change from Medicare Advantage Plan C to traditional Medicare with Medigap? What are the success rates?
Yeah, I will get to that. Yes.
Okay.
Big question.
And I believe that is the last question, unless Lynn sees something I don't.
Nope, that's the last one. Let me remind everybody that you enter your questions on the Q&A.
Great. Thank you.
Good.
All right. So now that, let's assume one has both Part A and Part B, and you've fully stepped into the Medicare world, there are two ways to arrange your Medicare, as we say. You could even call them one path versus another path. So the first path or way to arrange and use your Medicare is what we call original Medicare, where one can add it and one can add to it these Medigaps that you've been hearing about, or Medicare supplement insurance, and Part D drug coverage can be included with Medicare, original Medicare. Alternatively, one can choose to have their Medicare Part A and B benefits managed by a health insurance company by entering what we call Part C of Medicare. Now, entering Part C means you're enrolling in, quote, a Medicare Advantage plan that typically combines both Part A and B benefits under one roof, and often Part D drug coverage. And these take the form of HMOs or PPOs, health maintenance organizations or preferred provider organizations. So these are both on the Medicare Advantage side of Medicare. So let's examine original Medicare first. So what are some primary features of using your red, white, and blue card? Well, those who choose to use original Medicare may go to any doctor or provider or use any hospital, nursing facility, home health agency, and I'll say even equipment supplier that accepts Medicare anywhere in the United States. So it really broadens one's options for where to go and where to buy from, or which health or home hospice agency to use. So that, to me, is probably the most important feature of this fee-for-service payment model of Medicare, how it was originally designed, where medically necessary and reasonable services you receive are billed to Medicare, who outsources those to contractors. But Medicare would pay its portion, and you would pay your portion of whatever the Medicare approved amount is for your area, for the service. But there's a fee schedule that, if you will, controls the pricing of what you pay. Now, this is unlike Medicare Advantage HMOs. This is not an HMO style where you need a primary care provider, their medical group, and the health insurance company that manages your access to care. Original Medicare coverage is primarily determined by your doctor and the Medicare coverage criteria rules. Now, it's not a PPO either, where PPOs are a little more flexible. There are no network restrictions in original Medicare, but PPOs are designed to have in-network and out-of-network cost sharing. Now, what does Part A and Part B, what do those cover? So in original Medicare fee-for-service, Part A covers inpatient hospital services, skilled nursing care, home health care, and hospice care. Those are the four main areas of Part A. And as you can see, these terms, deductibles and copays. So when I say Medicare covers something, there's usually a deductible or a copay or a co-insurance, if you will, a percentage rather than a fixed rate. Part B covers outpatient care in general. It covers physician services, whether you're inpatient or outpatient. With the Affordable Care Act, it started including annual wellness visits and preventive services. Because normally, in the past, original Medicare was for acute services. I have a problem, I need to go see somebody. But of course, prevention so important now. There are added benefits to Part B. It covers home health care also. Like, some people don't have Part A but still need home health care, or vice versa. It covers diagnostic tests, which are typically low cost. Some therapies like physical, occupational, speech language pathology, even behavioral health, and durable medical equipment, orthotics, and supplies. So even diabetic supplies are covered under Part B of Medicare. You may pick it up at the pharmacy and think it's a Part D, but no, diabetic supplies, test strips, etc., are under Part B of original Medicare. There is a Part B annual deductible in addition to the hospital deductible I mentioned earlier. And these deductibles go up every year. This is now at $257, after which you would pay 20% of the Medicare fee schedule. It's important to know that Part A and Part B do not cover specific items. So Part A limits long-term nursing home stays to 100 days. Beyond 100, there's no coverage, the room in the bed beyond 100 days. It doesn't cover routine items. So routine dental, or really any dental care for that matter, dentures, routine vision. It doesn't cover hearing aids or hearing exams unless there's a problem. Cosmetic surgery doesn't cover anyone outside of the United States. Only maybe within short distances of the border. If in Canada or Mexico, it does cover you on the path to Alaska if you're driving up there. And interestingly, now that we're opened up and people are cruising again, it will cover you 6 hours to or from a port. So if you're going to get care on a cruise, ask your captain, are we, how many hours are we out of port? So, or how many hours before we get to port? So 6 hours is the key number. And Medicare will provide some coverage. And then you can also check on the Medicare website. So if it's reasonable and necessary for you as an individual, then Medicare covers it. You do have to meet certain criteria for certain things. And there are lists and lists called national or local coverage determinations that, if you want to get into the weeds of coverage, are listed in our area. It's the Noridian contractor, Noridian. You can search for, let's say, if I have cataract surgery, under what circumstance can I get eyeglasses? So that's one special situation. Or when does Medicare cover, I don't know if it's Ozempic, but certain procedures and so forth, or even certain medications. Okay, like I said, there are deductibles and copays in A and B, which is why these Medigap plans popped up, I think, in the 70s to cover what we call the gaps or out-of-pocket costs of just original Medicare, Part A and Part B. So let's take a look at the Medigaps now. Medicare supplement insurance, also known as Medigaps, are sold by private companies. They pay the gaps of Medicare. There are 10 standardized plans. It used to be the Wild West. In fact, I think that's why the SHIP program and HICAP started, was a lot of Medicare beneficiaries were being sold various Medigap plans to cover the different gaps in it, and people were getting taken advantage of. So it's now a very standardized and regulated product. Plans, not to be confused with parts A, B, C, and D. So there's Plan A, B, D, G, which has a high deductible version as well, KLMN, and then there are these plans that cover the Part B annual deductible that I mentioned earlier, the $257. Those are plans C and F. But Congress decided, no, we need to limit who can buy those. So only those who are eligible for Medicare before 2020 can purchase the C and F plans. To purchase one, it can't start unless you have both Part A and B. And in terms of terminology, retiree plans can serve as supplements to Medicare, or take care of the gaps in Medicare as well. But Medigaps are a specific product. Now, this chart shows on the left the different benefits that and coverage of Medigap plans. So, so here, the hospital inpatient, there's a co-insurance from days 61 to 90 of $419 per day. The nice thing about all Medigaps is they provide an extra 365 days of coverage. Here's the 20% co-insurance, pints of blood, hospice co-insurance. There's a skilled nursing facility co-insurance of $209 per day, up to 100, day 100. There's a hospital inpatient deductible. So that's $1,676 this year for the first 60 days of staying in as an inpatient. Here's the $257 Part B annual deductible. You'll notice no plans cover it except this bar should be down here. They're the only plans that pay it. There's something called an excess charge. Only the G plan and the F plan cover that. It's essentially, some doctors can have decided, well, I want to charge more than the Medicare approved amount. We call these providers non-participating Medicare providers. So they can charge up to 15% of the Medicare approved amount. Now, Medigaps, some of them, there are 6 of them, will cover foreign travel emergency. And then some of these were designed, these K&L plans, to cover a portion of the gap. So this plan pays 75% of the 20% that you owe, and then there's a maximum out-of-pocket limit of $3,600. So sometimes if you study these enough, you might think, oh, that might be a beneficial, or maybe even the N plan. The F plan and the G plan are the most comprehensive plans now, though, for folks. They cover, as you can see, almost every benefit that's out there. Okay, if you already have a Medigap plan, then it's easy to go to a plan with more to a plan with similar or less coverage. It's more difficult to go from less coverage up to more coverage. I'll mention why in a second. But we have these charts that show samples of rates. There are many, many companies, and there's a lot of consolidation sometimes, some you've never heard of, but again, it's a very standard product. If it goes out of business, you have the right to move into another Medigap wherever you are in the country. Their monthly premiums will increase as you age and annually due to medical inflation. So sometimes people will see and get 2 notices of increases. So you'll see these are age-attained rated plans. There are also plans called issue age rated. There may be 2 or 3 of those where it doesn't increase as you age, but just by medical inflation. And then there's something called a community rated plan, where the members of a certain age pay a common rate that increases just by medical inflation. So let's take a look now at Medigap enrollment. So let me just say that this is these aren't health plans. These are, gap coverage. So they don't follow the rules of, the Affordable Care Act said you can't be denied because of health issues. Well, here, health issues can be used to deny your application. So there are certain times where health screening is not allowed. So when is health screening avoidable? The first time is when you start Part B for the very first time, when it goes into effect the first time. That triggers 6 months of what we call a Medigap open enrollment, where you can you're not required to answer any medical questions. Additional protected times, I guess you would say, are after events like the loss of coverage. So the loss of COBRA, let's say, a change in residence where you leave a Medigap service area. And then also in California, there is a right triggered when a Medicare Advantage plan increases its premium for the upcoming year or increases copays a certain level. And we'll talk more about that. That triggers a chance to get back to original Medicare with a Medigap, no questions asked. Some other ones I want to mention are if you're just joining Medicare, and go right into a Medicare Advantage plan, then you have 12 months to test and try out a Medicare Advantage plan. If you don't like your Medicare Advantage plan within 12 months of your joining at 65, you can get a Medigap, no questions asked. So it kind of extends this 6-month period if you jump into MAs right away. And then lastly, let's say you have a Medigap and have never joined a Medicare Advantage plan, but you want to try it out. Leaving your Medigap for a Medicare Advantage for the first time, you have 12 months to test it. If you're not happy and want to get your Medigap back, you can do so, no questions asked. Now, aside from these, and other states may have other consumer-friendly protections like this, but you can sign up for Medigap anytime you have or will have original Medicare. But health screening will need to be passed. And again, state laws may vary. Now, where can you go to compare these premiums? So we suggest using the Medicare.gov Plan Finder tool. So you go to Medicare.gov, you can compare Medigap premiums. The premiums are based on one zip code and age. And then you would want to contact the plan for your individual quote. Now let's turn our attention, well, let me stop there before we move on to drug coverage. Any questions about Medicare supplement plans that work with original Medicare?
There are a few questions.
Okay.
This one you partially answered. Do ABD Medigap cover medical expenses when traveling overseas? If not, is the only option is to get travel insurance?
Yes, that's right. So the plan D, G, M, N, C, and F covered foreign travel emergency. What is it? I think it's there's
50K limit?
That's right, 50K limit. There's a deductible. It's the 50K limit is a lifetime limit.
And I understand that most travel insurance is secondary to Medicare. Even if your Medicare doesn't cover it, you still have to submit before your travel insurance does.
Yeah, travel insurance, even though you may have this type of coverage, travel insurance, I don't know though if that's correct. I could be wrong. Usually Medicare wants other people to pay first. I don't know if I don't think there's coordination between there isn't coordination between travel insurance and Medicare. Maybe I guess you'd have to check the travel insurance rules.
The specific policy, yes.
Yeah. Okay.
Okay. Next question. And when you said 6 hours to port, I assume that has to be a US port.
Correct. Mm-hmm.
I have original Medicare and Plan F extra and never seem to have to pay the deductible. Also, I think I'm entitled to a yearly hearing test at a place like Sutter Health.
Right. So this chart here shows you the you know, the basic how they originally started with you know, covering the gaps of Medicare. Some plans might add some extra benefits, as you mentioned, but yeah, the Plan F covers everything, including this 257 deductible. So yeah, very comprehensive coverage. So the bill goes to Medicare. Medicare sends the remainder based on this chart to, well, if Medicare approves it, then it goes to the supplement plan. Then they send any remainder to you that you may owe. If Medicare doesn't approve a procedure or service, then the Medigap will always deny it. The main question is, you know, but once it gets approved by Medicare, then we see no problems with these Medigaps just doing what they're supposed to do.
I understand all insurer plans under any letter have to be the same, so shouldn't I just pay the least expensive of the plans you choose, the plan you choose?
Right. So yeah. So the general advice is, you know, a Plan F or Plan G from one company is going to do the same thing according to this chart, regardless of the premium. So you're really not paying for more coverage, Medicare type coverage, with a higher premium. So it's that's correct.
Can't you change Medigap providers and CA around your birthday?
Right. So I didn't mention it earlier, but yes. So if you already, yeah, if you already have a Medigap and you live in California, you have what's called a birthday open enrollment. It's called the birthday rule. Your plan should notify you that 60 days from your birthday, you can, without underwriting, switch to a plan of equal or fewer benefits. So in other words, if you have a plan G with one company, let's say company number one, and it's $300, you can, during your birthday, move to company number two that maybe charges, you know, $250 per month. So yeah, the birthday, especially if you have chronic conditions or medical issues, you can't be denied in that 60-day period, as long as you go to a plan of equal or fewer benefits. If you were in a plan N and you wanted a plan G, the birthday rule won't help you. You would have to answer the medical questions and pass them.
Please clarify, no health screenings within 12 months of joining a Medicare Advantage plan. Does that also if apply if joining a Medigap plan during a SEP after age 65?
Okay, so this one, yeah, let me expand on this. So this is what we call a trial right. Trial right. I'll say number one, trial right. So if you use your IEP to join a Medicare Advantage plan, and you for the very first time, you've never ever been in a Medicare Advantage plan, um, you have 12 months to try it out, hence the word trial. If you don't like it, you can, let's say in the 12th month, you can drop it and go to original Medicare and pick up a Medigap without underwriting. Guaranteed.
Does that also apply to special enrollment period?
That part of the question I didn't quite understand. Could you repeat that?
Well, he said SEP during the SEP, which I believe is special enrollment after age 65. So if you haven't taken,
Okay. Mhm. Right. So if you're in an SEP, you haven't signed up for Part B yet, this is the guaranteed issue right that would apply. The first time you sign up for Part B, you could go, you're going to sign up for Part B. You can approach a Medigap company knowing this, you'll tell them, my Part B, I'm starting it. I have this SEP because I've been working. I'm retiring, so Part B is going to start in October. So October would be the first month of guaranteed issue right to the Medigap. So your Medigap would, so if it starts October, November, December, January, February, March is in that time frame, you can get a Medigap, no questions asked.
If you at first started with an Advantage plan during your special enrollment, do you have a year to change to Medigap without?
Oh, I see. No. Well, no. I don't think so. I mean, the way it's written in our code here, I think it's a national code, but it says when you sign up for Medicare Advantage at age 65. And by that, I haven't had anyone test it, but at age 65, the only enrollment period available at age 65 is the IEP. Of course, if you have an SEP, and your IEP's done, and you're still 65, and use it to sign up for an MA, does that count? I think I have to get even more clarification, but I haven't seen that happen.
Do all Medigap plans have a maximum out-of-pocket or just K&L?
Just K&L. If you will, another way to think of, let's say, the Plan F, thinking about maximum out-of-pockets, since the Plan F covers everything, your maximum out-of-pocket is your premium, your annual premium. Like that is the most you'll pay in medical and hospital costs. The Plan G, it caps everything except the $257 deductible. So it's your annual premium for G plus $257. That's your maximum out of pocket, if you will, with original Medicare and a Medigap. So,
Other than CA and a few other states' birthday exemption, can one change Medigap policies during the open enrollment period without incurring medical review?
so in California, when we say Medigap open enrollment, it assumes there's a guaranteed issue right, no medical review. This is different, of course, from the annual enrollment period that we're about to enter. So you can change Medigaps anytime you have original Medicare. Unless there's some protected event or a trigger for a Medigap, what we also call guaranteed issue right, you'll have to answer medical questions.
Open enrollment is not covered under that.
No, just to be clear, there's Medigap open enrollments, and then there's Medicare annual enrollment period. There's also the so I guess I would need the questioner to ask which open enrollment we're talking about.
Okay.
Yeah.
In looking at the chart, why would anyone sign up for Plan K rather than Plan L?
Yep. That's my conclusion too. I guess if there's a significant difference between their premiums, but not many companies sell the K&L plans.
What happens after the 100th day of using skilled nursing facility co-insurance?
Then there's no more Medicare coverage for the stay itself in the nursing facility, and one would have to pay out of pocket or or through a long-term care policy, or maybe a different retiree plan that has coverage beyond 100 days in a nursing facility, or Medi-Cal or Medicaid covers long nursing home stays for folks, but you need, lower income and resources for that.
The next question I'll answer, will this recording be available approximately a week? The person doing the editing on the presentation is traveling, so it might be take a couple days longer. Next question, I'm confused over the basic difference between Medigap and Medicare Advantage. Could you repeat? For example, do you sign up for Medigap G, then pick a Medicare Advantage plan that covers G? Sort of
No,
confused.
so right. So these are mutually exclusive paths. So either you're in original Medicare with a Medigap or a retiree plan, let's say, or you choose to be on this side. You cannot use a Medigap to pay for the out-of-pocket costs of a Medicare Advantage plan. If a person has a Medicare Advantage plan and wants a Medigap, you have to tell the Medigap company you're leaving the Medicare Advantage plan and going back to original Medicare before they can sell you one. But for some reason, some people have Medigaps and join Medicare Advantage plans and erroneously continue to pay the Medigap premium and can get, so I think we'll talk about that a bit more later, but yeah, so 2 different products.
Mutually exclusive products.
Yes.
Is the modified AGI amount for Medicare premium recalculated every year, or is the one when you apply for B originally used going forward?
Every year. So the brackets have changed over the years. Don't know if there's a change coming up this year. I don't think so. But yes, but also the IRMA amounts do change as well. And the Part B premium also goes up.
Which is based on your income 2 years earlier.
Correct. Yeah. Unless you had a life-changing event and submitted that form.
Did you imply that Plan G basically had an a maximum out of pocket?
I did. It doesn't. I mean, it doesn't state it. But what is a maximum out of pocket? It's a cap on your co-pays and deductibles. So original Medicare has no maximum out of pocket limit. That's why a Plan G or Plan F or these Medicare will protect you up to a certain amount. The Plan G, you could argue then, or you could say the maximum out of pocket with a Plan G is whatever the premium is. So for young Medicare beneficiaries, that might be in some areas 140 per month. So that's 1,000. What am I? Quick math. 1,400 for 12 months plus 2, so 1680 per year, and then you add in 257, so you're about $1,900 is what your cap is for medical and hospital out of pocket. That's the cap of your medical expenses, is your premium plus about maybe this much. So just a different way to think about maximum out of pockets if you're in the original Medicare world.
The link for the recording will be emailed to attendees when it's available. We don't send the entire recording, just a link to the recording. And I think that's all of the questions so far.
Okay, great. So let's turn our attention to drug coverage that can be added to original Medicare. But more generally, Part D was started in 2006 to cover outpatient prescription medications. Drugs can be covered under Part A if you're in the hospital setting. Part B drugs are also, there's a list of Part B drugs that are usually not administered by oneself or are administered by a durable medical equipment like a nebulizer. But outpatient drugs are covered under Part D. Once you have Part A or B, you are immediately eligible to enroll in Part D. And it should be done in a timely manner to avoid a late Part D penalty. But if you have other drug coverage that is as good as Medicare Part D drug coverage, then you need not sign up for Part D and would avoid incurring a late penalty in the future, as we mentioned earlier. Now, drug coverage for original Medicare is had by enrolling in what we call standalone Part D plans. And in California, there are 16 standalone prescription drug plans, or PDPs, if you will. Another way to have Medicare drug coverage is to enroll in, I'm getting ahead of myself, but enrolling in Medicare Advantage plans. These include drug coverage in their premium. We call these MAPDs. Again, you need both A and B to join a Medicare Advantage plan. Examples of creditable drug coverage, maybe your COBRA drug plan, drug coverage is, retiree drug coverage might be creditable. VA, we know, is creditable. In 2025, plans varied from $1.80 on the low side to $183 per month. Most increased their premiums in 2025, and we anticipate 2026 will have large increases as well. Oddly, not oddly, but there are calculations that go into determining plan premiums. There was one plan for the past several years that has had low, like single-digit premiums. So we'll see what happens in 2026. The deductibles are set by Medicare. They can range as high as $590. If a plan chooses a lower deductible, chooses to establish a lower deductible, then it's sort of indication of what we call an enhanced or alternative drug plan. Some can be completely eliminated, but then you're usually paying like a high premium for those that have no deductible. Across the country, there's an average base premium established each year. This year, it's $36.78. It's used to calculate the late penalty, which is, may not be as bad as you think. For every month that you weren't enrolled in Part D, then it's 1%. And again, it's a permanent late penalty. So if you didn't sign up for 12 months, you'd have 12% of the base premium. So, maybe, 36 cents if it's to say 10%. So, okay. Now, we suggest people go to Medicare.gov to create an account and use Plan Finder every year to analyze your PDPs or even MAPDs to look at the premiums and the total out-of-pocket cost per year for the plans. Drugs go on and off formulary each year. And so you don't want to be caught in a plan that doesn't have your list of medications. Now you might ask, well, sometimes I'll get a prescription in the middle of the year. How do I know my plan's not going to, it's on the formulary? Well, a good practice might be to, let your physician know, which drug formulary, can you pick a drug off my formulary? If not, if your doctor insists on a drug that's not on the formulary, but it's covered by Medicare, there are appeal processes. You can request an exemption to get the drug on the formulary. You can also appeal any quantity limits. You can appeal other restrictions like step therapy that plans put in place. So step therapy is where the plan says, well, I know your doctor says you need to take this expensive drug, but we need you to take the lower cost drug first. Now, if that doesn't work, then you can use the more expensive medication. So that would require an appeal. If you wanted to jump right to the more expensive drug, you'd get your doctor to help you put in an exception for that. So don't pick these plans just based on the premium. You really need to put your drugs in, the pharmacies that you could see yourself using. Put a whole bunch of pharmacies, because sometimes the contracting is really different between one drug and one pharmacy and one plan versus another. So we help people with these analyses as well. But it's really simple to use. If you go to find health and drug plans, then put your zip code in, select you want a drug plan, and then you start entering. But you'll want to also, again, create an account here so that your list of drugs is can be stored year to year and updated. Like Part B, there's an adjustment. So again, depending on your IRMA or your MAGI, you could get an extra charge in addition to your Part D premium. So it can be as high as $85.80. If you don't sign up for D, then you're not going to get this. It's only when you're actually in a drug plan. There are programs that help for individuals with income below $1,976 per month, for couples with less than $2,664 income per month. There is an asset test, savings and asset as well. So it's called the Extra Help Program. It lowers drug premiums and the cost at the pharmacy. So if you know anyone that needs drug help with lower incomes, certainly send us our way. We can help them apply, or they can apply on Social Security's website. Okay, so we've just finished talking about original Medicare. We talked about Medigap plans and drug coverage. So a person would have 3 cards in their purse or wallet showing the red, white, and blue card plus Medigap card to the physician or hospital, show the drug plan at the pharmacy. Okay. So let's see if there are any questions. If not, we'll move on to Medicare Advantage, Part C.
There's one question. Sorry, I missed the website where you can input your medications in pharmacies.
Oh, yeah. So it's Medicare.gov. Medicare.gov.
Okay, that's the only question right now.
Okay, great. You can also go here and evaluate the MAPDs, Medicare Advantage prescription drug plans, which we're going to get into now. So Medicare Advantage is a capitated payment model, has a capitated payment model, where a health insurance company receives a monthly dollar amount per member per month, and that amount is adjusted based on health risks, maybe the geographic location, the plan, star rating, and other factors. So in our county, we have 50 different Medicare MAPDs. All of them, well, all but 3 include Part D drug coverage. Why is that? We have the VA system here, so those 3 plans are sort of catering to veterans who may not want to, don't need Part D drug coverage with their Medicare Advantage. In these plans, just as a side note, if a person joins one of these 3 plans that doesn't have Part D, they can't join a PDP. That would put them back in original Medicare. Okay. So Medicare Advantage plans are offered by health insurance companies, sometimes called health maintenance organizations. They offer plans in particular service areas, typically county-based. So you have to live in the county of Medicare Advantage plan. You would obtain care and services from the contracted medical group of an HMO. Now, in an HMO, you pick a primary care doctor first. So the important factor we say if someone wants a Medicare Advantage plan is, does your doctor contract with the plan? There are bells and whistles, but we emphasize access to your doctor or doctors or clinics, and taking that approach. There are deductibles and copays as well set by the plan. And fortunately, there are maximum out-of-pocket limits. This started with the Affordable Care Act that, put a cap on hospital and medical costs. If you go outside of a plan's network, you have no coverage. In an HMO, you would pay for that care. And tier Medigaps cannot be used for Part C costs. Medicare Advantage plans do provide extra benefits that A and B don't cover. So that list of non-covered A and B benefits, sometimes Medicare Advantage plans do provide those. They use the capitation money to provide these extra benefits possibly. Now, you've probably heard a lot of news about these plans in the form of prior authorization. So yes, these plans can say and authorize your treatment or not authorize it. So we see that more on the Medicare Advantage side. There's some authorization in original Medicare, mainly with some supplies or equipment that maybe have a history of fraud and abuse, but there really isn't prior authorization, although that's being tested now by the current CMS group. So in our area, premiums range from $0 to $79 per month. Maximum out-of-pocket limits can be as high as $93.50 per year. Some have them as low as $297. There are also drug deductibles, again, the same as PDPs, up to $590. We used to have over 60 plans in our area. Some areas like LA or Orange County have over 100 plans. It's kind of mind-boggling. So these plans can go in and out of markets, leaving their members to figure things out during this upcoming annual enrollment period, October 15th to December 7th. It can be somewhat disruptive for people who are losing their Medicare Advantage. We have lists of the plans that show that their plan ID number, the star rating, their websites, the phone numbers. And then we also try to, as best as we can, inform people about the medical groups that the plans contract with. They can contract with multiple medical groups. Here we have, this one is Santa Clara County Independent Physician Association, SCIPA. Physicians Medical Group of San Jose, which I think is now Optum. And then you'll see premiums, which are composed of a health portion and a drug portion, resulting in a total premium, and then maximum out-of-pocket limits that you can see here. And then these are the different copays for hospitalization, nursing facility, primary care doctor, specialist copays. Some of them are zero, some are higher. Emergency room copays, urgent care copays, DME coinsurance, so 20%. So these make you nervous a little bit, because what is 20% of what? Same with 20% of what type of chemo. That could get you up to the maximum out of pocket real quick. Hearing exams, aids, so anything below this line are extra benefits. So some cover hearing aids, exams, dental, vision, fitness benefits, and then they have their own drug copays as well, depending on the type of medication. Plans are starting to introduce like non-medical extra benefits, so to speak. So for certain groups of certain members with chronic conditions or coming out of a hospital, maybe they'll provide meals, maybe there's transportation, some cases dog walking that not all members can get, but if you meet certain criteria, you might be able to get those extra benefits. Okay. There are Medicare Advantage plans specifically designed for people with both Medicare and Medi-Cal. You'll notice that there's, premiums are essentially zeroed out. There should be no copays or coinsurance. The one you see here, these actually go to zero if someone has Medi-Cal, but for some reason they have to list them out this way. Okay, so Medicare Advantage plans are required to cover all the Part A and B benefits. By enrolling, a person is assigning their A and B benefits over to the health insurance company and the plan. And again, they can offer extra benefits. So let me stop there and see if there are any questions about Medicare Advantage before we sort of do a comparison.
I'm not seeing any new questions.
Okay, great. So let's move on. So just some differences, right? Obviously, where you can go for care. With the Medicare Advantage plan, you can't go across the country. It doesn't make sense if you have 2 homes to have a Medicare Advantage plan. Maybe if you have a PPO Medicare Advantage plan, that could, but there's no guarantee that the provider outside of the county would necessarily take you as an out-of-network PPO provider. So in terms of access to care, Original Medicare provides access to a wider group of specialists throughout the country. Prior authorization requirements, Original Medicare doesn't have prior auth to the extent that Medicare Advantage plans do. So there are layers of approval potentially in Medicare Advantage plans, and we're seeing that play out. So that adds time to service, I would argue. The premiums and out-of-pocket costs. So if you're healthy, you could save quite a bit of money in a Medicare Advantage plan because there's 0 premium plans out there. If you aren't using services, you aren't paying out of pocket. Whereas with Medigap plans, the comprehensive ones have, you're paying more up front. They don't, but if you're, if you use services a lot, cancer, transplants, high bills, then your out-of-pocket costs could be more limited. You'll have more access with Medigap's Original Medicare. Original Medicare, though, doesn't have these extra benefits that can add up, like hearing aids. Those can be rather expensive. Some plans have coordination. So if you have difficulty, managing your appointments, if you're on your own and you're not sure and you need some assistance, some plans might have coordination services. And then Medicare Advantage plans have some help with non-medical items too. The nice thing about Medicare Advantage plans is there's no underwriting. You can join them at any time, at the right times. But they aren't going to look at your health history. Even people with renal failure, end-stage renal disease, can now join Medicare Advantage plans, which is, I think it only changed within the past, I want to say within the past 5 years. Okay. So just a bit of a summary, like I mentioned earlier, they could be problematic if you have a lot of serious health issues and may need longer post-acute rehab stays in a skilled nursing facility. Medicare Advantage plans are capitated. They have a set amount of money per member per month. So someone's counting how much is being spent for you. And in some ways that does affect, we see more MA plans moving to discharge folks on a quicker basis than, say, with original Medicare sometimes. Now we say these things because we want people to be informed of what we see, what we and the potential experience they may have in choosing one or the other. And sometimes one works out well for the other and vice versa. Now we're entering the annual election period. This is a chance for anyone with A, B, or both, or C to change drug plans, change MA plans, move from original Medicare to Part C, or move from Part C back to original Medicare. If you're trying to move from Medicare Advantage back to original Medicare, you first want to make sure you're approved for a Medigap plan or have other supplemental coverage to limit those unlimited original Medicare out-of-pocket costs. Now in California, and in our area, we found that 54 Medicare Advantage plans made changes to their 2025 plans that were enough to trigger a Medigap guaranteed issue right in California. Not every state has this, but we do. So basically this says that you can buy a Medigap, no questions asked, if these circumstances happen with your Medicare Advantage plan. There are, strict time limits. So if you're planning on switching, get in touch with us early, look for your annual notices of change, and you can start planning. Those annual notices of change should be coming out either electronically, but they have to be in your hand by September if you're in a Medicare Advantage plan. To enroll in Part C and D plans, you can go directly to the plan, the insurance company, or you can call 1-800-Medicare, or you could do it online at the website I showed you earlier, medicare.gov. Medigaps are enrolled in directly with an insurance company, or I would say even a trusted broker could be very helpful. Who has your best interest in mind and will give you the full scope of your options. And lastly, I just want to say a word about fraud and abuse. Guard your card, even though it's no longer your social. That number is often sought after by unscrupulous folks who will use it to bill Medicare. They'll also have to work with a provider that is unscrupulous too, to bill Medicare for things that you don't receive. Imagine equipment being billed to your number. The problem is that if you should need any of these services, Medicare will say, well, we think you already have it. So it would delay your services. Your services could be denied. So check your statements for accuracy. your Medicare summary notices, even your Medicare Advantage notices, to ensure that what's being said is done has actually been done. My mom was a victim. I think a lot of people were receiving COVID tests and without them, ordering them. And so the Office of Inspector General, I mean, they've done a great job and are really cracking down on fraud and abuse. That one came out of Florida. A lot seems to come out of Florida, but certainly throughout a lot of other states, there are some bad actors. So, Senior Medicare Patrol exists. Their number is 408. That's our number. We can connect you to Senior Medicare Patrol. They'll help investigate any fraud and abuse. So let's see. There's I don't know. Can you hear this video?
No, you have to
No.
join with
Okay.
audio for that to happen.
Okay. So I'm going to skip that, but that's essentially, encouraging to report fraud and abuse. Um, so again, here's our contact information. Shiphelp.org for those in other states. This is the California ship line, and then ours here. So, all right. Well, thank you for bearing with me. I hope I answered all your questions. If not, I'll stick around. So thank you again.
There doesn't seem to be any questions in chat in the question and answer, but I do have one question. I believe that you said if they had VA, they may not get, they may choose not to have Part D, but Medicare won't fill a VA prescription, a prescription written by a VA doctor, correct?
Right, you need a VA doctor to fill that prescription.
And the
Oh, I
VA,
see. So if a person um,
so VA won't fill a Medicare prescription and Medicare won't fill a
right,
VA prescription.
yeah, there's no coordination between those. If a person had Medicare Part D and brought the prescription to a pharmacy that, I you have to go to the VA pharmacy, I think. I'm not exactly sure, but no, you can't take your Medicare doctor's prescription to the VA to get it filled, and vice versa.
I understand that you can't contribute to an HSA once you have Part A. Can you use what you already have in an HSA account to pay for Medicare premiums?
Yes, you can. The only premium you can't use an HSA for are Medigap premiums, but you can use it for Part B and other health expenses.
Okay. Are
And
the, go ahead.
oh, and the Part D premium, let's say, or a Medicare Advantage premium. Yeah.
Part D, you said it cannot be covered by HSA?
Oh, it can be. Yes.
Can be,
HSA. Yes.
just a Medigap, okay.
Mhm.
For disabled adult children that have SSDI and are eligible for A and B, there doesn't seem to be a way to get a Medigap policy for them until they turn 65.
Oh, okay. So anyone qualifying, including disabled adult children, qualifying for who have Medicare, uh, they generally have the same guaranteed issue right, open enrollment rights as people with Medicare due to age 65. So the chance to get a Medigap well, let me just back up. Yeah, they can get a Medigap. The premiums are typically much higher until one turns 65. But there are protected times, same one. So once a person starts Part B, there's 6 months to get a Medigap, no questions asked. If they're in a Medicare Advantage plan and the MA plan increases rates, et cetera, so a lot of the same protections would apply. But outside of those protections, underwriting and most likely denial.
Or international, where you're within the 50K limit on the lifetime. Does Medicare pay at the rate you were billed or at a Medicare rate?
So Medicare wouldn't cover the,
I'm sorry, the F and G plan.
oh, I see. So it's my understanding that um, well, I don't, I think it's you receive the bill and with support documents from the overseas facility or doctor and submit it as a claim that way and then get reimbursed. I don't see how they would adjudicate it based on the Medicare fee schedule.
Okay. Uh, How do you find, I guess you have to check individual policies for Advantage plans. A friend has Kaiser Senior Advantage
Mhm,
and was hit with a $256 bill for an MRI. And I guess
mhm,
someone else was being told $1,000 for an MRI.
mhm,
That was unexpected.
mhm. So yeah, keep in mind Kaiser has many types of Medicare Advantage plans. Some of them are like employer sponsored, but Medicare type retiree plans that may have lower copays than what one could find um, on the open Medicare Advantage market. Um, an MRI, um, but they're usually copays. So not sure why. I've never seen $1,000 copay for an MRI in a Medicare Advantage plan, but there could be if unless it's a co-insurance that is being charged under that particular Kaiser plan. Um, so we'd really have to look at the different plan and source of the Kaiser MA plan.
Okay, a couple questions and some compliments have come in. How would Marcelo choose between Medigap and Medicare Advantage? How does he think about it? Is it obvious to him what is better for most people?
Um, yeah, it depends. I mean, there are, as you can see, many factors. Um, First, I'd say, well, financial. Um, um, on the whole, paying upfront for Medigaps, comprehensive Medigaps, will be more out of pocket upfront, but they'll protect you from copays throughout the year. Over time, those premiums could add up. Let's say, you're spending, if you're already in your 70s or 80s, some of these Medigaps, depending on your zip code, could be in the high hundreds to $200 range. Um, and that adds up over the years. And so you might think, um, um, had I been in a Medicare Advantage plan all these years at zero premium, I could have saved a lot. Of course, so one has to weigh their risk. Um, um, if you know you have a lot of health expenses um, coming up, um, or you want access, outside specialists, then Medigap makes the most sense um, to me. Um, especially maybe you want to go to Cedars-Sinai or UCSF and you live here in this county. You can't do that with a Medicare Advantage plan. You might do it with a Medicare Advantage PPO, but there's no guarantee that Cedar or UCSF will accept your PPO as out of network. Why? Because um, there's a chance that they may disagree with the plan about whether coverage should be had or not. And so they don't want to get into a battle with a PPO plan that they're not in network with. Um, so now if you're, financially can't afford a Medigap, then then there are Medicare Advantage plans that make sense, and you have to find the right network of doctors that meet your need. But understand that there could be, prior authorization issues. You have to follow their rules. You must go see the PCP first, and then get a referral to a specialist. If you're trying to go out of network in an HMO, as maybe I'm sure everyone knows, that takes a lot of time and it may not be granted, in which case you'd be paying out of pocket. I've had cases like that, and those are the ones that kind of stick in my mind. I've helped people move in both directions. I've had cancer patients in an HMO not getting what they need and want to get to a facility in another county or to another medical system. And we found the right, the timing worked out. Their plan made a change in California that triggered a chance to get a Medigap that they could probably not get without protection. So I can't say for everybody, but I suppose if I had enough wealth, I would. Now, let me just back up. We're seeing some systems putting restrictions on access to their primary care doctors. The one in particular, well, of course, what comes to mind, Kaiser. You have to be a Kaiser member to see Kaiser Permanente physicians. But in our area, Sutter purchased Palo Alto Medical Foundation. Sutter is not allowing original Medicare beneficiaries access to primary care, their primary care doctors. We're sort of holding them for Medicare Advantage members, unless you have a previous relationship with that primary care physician. It's Sutter. Sutter will allow original Medicare beneficiaries to access specialists, no problem. So, I used to say carte blanche, original Medicare, you could go to any doctor in Medicare, but we're seeing these limits now. Okay. Long answer to your question. I don't know if that really helped you, but that's how I sort of think through things.
Why would one wait to sign up for Part D since there are penalties?
Well, someone might not, and I've seen this actually, some people don't take medications at all, are relatively healthy, and just, years go by and they don't have Part D. So one could argue they save 10 years worth of, maybe $3,000 by not being in Part D. So they took a gamble. But now they need Part D. And that, like 10 years, what is that? That's 120% on top of the average base premium. So at some point, not signing up for Part D will have caught up to the person down the line in penalties. But some people make that decision to risk. But in my estimation, why not just pay the low premium Part D plan for the protection and avoid the late penalty as well? That was an easy decision now that we've seen for the past 4 or 5 years plans in single digits. But even a $12, $15 plan, there's a lot of drugs out there that can be very expensive. So for $12, $15, $20, you can cap any drug costs at $2,000. Next year it'll be, I think, $2,100 or $2,010. I can't remember, but it's just about risk protection.
And for those that have
health.
VA, there's no penalty, right?
Right.
The last question I see is, prior to signing up for Part A, do you have to make sure you've not contributed to an HSA in the past 6 months?
So Yes, not 6 months. I mean, so I think the way I think about it is, keep in mind, Part A goes back 6 months, but no earlier than your 65th birth month. So there's an effective date on your Medicare card. So if after the Part A effective date there are contributions, then those would be considered excess, and you try to remove those. Um, there was a scenario I think someone brought up. Let's say you're in your IEP, you can, and you're going to sign up for Part A, then you want to stop contributions, before you turn 65, because your Part A will go back to age 65. But no, not earlier. So
There's a number of compliments. This was by far the most informative Medicare presentation I've seen. You were able to answer everyone's questions, including mine, comprehensively. The speaker was
oh,
exceptionally well versed and able to explain details in methodical style without getting sidetracked by questions. Thank you. And just a number of thank yous.
oh, you're very welcome. I'm glad I could help answer your questions.
Okay,
Yep.
one more that came in was, how do I know if a PCP accepts original Medicare?
Right. So what you do is you would go to the Medicare.gov website. So let me, I can, yeah. So the Medicare.gov website there's a section that says find. Let me pull it up. So here. Okay. So can you see this Medicare.gov website? Is it show?
Yes.
Okay. So here, here of course is where you can log in, create an account, find your drug plans, and then find care providers. So if I click on this, you can find not just doctors, but hospital, nursing home, dialysis center, medical equipment suppliers even, but doctors and clinicians. Then you'd put your, let's say, zip code. And then if you're looking for a PCP, you could select this. And then within 15 miles of that zip code, it shows doc. So let me just say within 5 miles, apply. And then you can say board certified. Here you can say, okay, I want a doctor that always charges the Medicare approved amount. Okay, so now we're down to, 300 PCPs. And so this is where I would begin. I will say in our area, finding a PCP, you don't already have one, is becoming a challenge. So you have to find different ways, talk to, use your contacts, or do this to start looking and finding PCPs if you don't already have one. Okay.
Okay,
Marcelo, thank you very much for a very informative, thorough exploration of Medicare. We appreciate it.
Yeah, you're welcome. You're welcome.
there's one
Thanks for
last
having
question
me. Sure.
that came in. You mentioned Sutter PCP does not accept Medicare.
Oh, yeah, original Medicare. Here in Santa Clara County, if you're just starting off on Medicare and you choose original Medicare, you cannot pick a Sutter PAMP PCP. They will only allow Medicare Advantages members who contract with Sutter. So in our county, there's what's called Alignment Sutter Advantage, and WellCare is the other HMO that contracts with Sutter PAMP. And those members have access to PCPs. Sutter PCPs.
Thank you.
You're welcome. Yeah. So just a small tip then. Again, if you establish a relationship with a Sutter PCP, then you can use original Medicare to see that PCP. You're sort of under continuity of care type provisions. So, okay, thanks for sitting through this. I know it was a ton of information, but feel free to reach out to our HICAP, your HICAP, or your SHIP, and thanks again.
Thank you.
Take care.
Thanks and have a good day.